Hi, my name is Pauline Isabel Isanteno from ESN2A, and today I will demonstrating the funding height measurement and Leopold's maneuver. So, the purpose of the Fundic height measurement is to determine the gestational age of the baby. This is the distance in centimeter from pubic bone to the top of the uterus. On the other hand, the Leopold's maneuver, the purpose of it is to determine the fetal position and presentation by palpating the abdomen without using the ultrasound. To proceed, the materials needed is the tape measure with centimeter, notepad and pen, stethoscope, watch with second hand, and the drape. So the procedure, we need to first assess our patient. We need to review the client's record of last menstrual period and the prenatal visit. This is to get the baseline data of the patient. Next one is to gather the necessary materials. This is to save time and effort. Next one is we need to plan. We need to identify the client. By identifying the client, we can see the ID band or ask the patient directly. So, for example, Ma'am, what is your name? Or we can see the ID band on the wrist of the patient. Next one is we need to explain the procedure to the patient. In explaining the procedure, it lessens anxiety and gain the cooperation of the patient. For example, hi ma'am, today I will performing the Fundic height measurement and Leopold's maneuver. So, and then we need to perform hand hygiene. This is to avoid transmission of microorganisms that causes illness. Next one is we need to close the room, the door or the curtains. This is in closing the room and the curtains, we provide privacy as the client expose her entire abdominal area. And then we will place the bed on appropriate, comfortable in working height. This is to the procedure properly and to avoid likelihood of injury to the patient. Next one is ask the patient to empty her bladder. In emptying the bladder, the full bladder displays the uterus for accurate measurement. Next one is we need to the implementation. So for implementation, we need to position the client in a dorsal recumbent. So what is the dorsal recumbent? So we will place the client in supine position with the hip flexed and the legs are separated and the thigh are flexed like this one. And this is to provide maternal comfort and better result for assessment. Next one is we need to drape the client. We need to cover the client with a blanket, raise to the lower extremities to provide privacy. And then we will now expose the client's abdomen. Warm our hands by rubbing against one another before placing it on the abdomen because cold hand stimulate uterine contraction that making hard to perform the assessment. So we will warm. So next procedure is we need to observe the woman's abdomen as to where is the longest diameter each and where is fetal movement is more apparent. And then we will measure the distance abdominally from the top of the pubic symphysis over upper part of the fundus. This is to determine the height of the pregnant abdomen and to estimate the age of gestation. So we will get our measuring tape using the centimeter side. We will start on the pubic symphysis, so here, over the curve up to the top of the uterine fundus. So as we measure, we get 29 centimeter. So since the patient has a 29 centimeter, so we can say that the age of gestation of the patient is about on 23 weeks. So as we interview her on the first part of our assessment, we take note the last menstrual period of her is on August 27, 2020. So as we compute the age of gestation, the total number of days of the patient is 161 days plus 3 days, total of 164. So 23 weeks plus 3 days, and the centimeter we get is 29. So we can evaluate the age of gestation and distance between the pubic symphysis up to the upper part of the fundus is relatively normal. So next one is we now proceed to Leopold's maneuver. So the first thing we need to do is we need to face the client's head part. So we will stand at the right side of the patient and we will face her head. And then we will palpate the upper part of the uterus, which is the fundus, this area, with our both hands. And we will observe for the shape, consistency, and mobility. So here, so we will apply gentle pressure to determine what part of the fetus that we palpate. So don't be afraid in applying pressure because remember, there is an amniotic fluid that will protect our fetus against the pressure. So the first maneuver is also known as the fundal palpation. So this determines the fetal presentation. So as we palpate, so if we palpate, it has a hard or firm and then round shape, and it moves independently with the body. We can assess that the head part is in the upper part of the fundus. That indicates that it has a breech position. So if palpate the soft nodular and it only moves and there is a conjunction within the body, so we can say that it has the buttocks of the fetus. So we can assess or evaluate that the fetal presentation is cephalic, or the head part is in this area. So next one is we will now proceed in second maneuver. So this is also known as the lateral palpation. This lateral means patayo. In this one, we need to still face on the client's head part, and then we will place our left hand here, stationary on the right side of the uterus to immobilize. So, and then we will now palpate the left side of the mother here. So here, from the top to the bottom bead and to the bottom bead our right hand. So top. So as we put our left hand, so as we palpate, so next one we will palpate on the other side. So we will just apply gentle pressure. So this maneuver locates the fetal back of the fetus. So as we apply deep pressure, so we can determine which side of the fetus it is. So after repeating the palpation using our left hand here, with our right hand stationary on the other side here. So just like as we palpate, so on this, I feel there's a smooth here and hard but resistant that indicates it is the back of the fetus. So it is smooth. So as we palpate, remember this side, so we can assess the fetal heart rate or heart tone in this part or area. So we can assess the fetal heart tone in the right lower quadrant of the patient. So this is the fetal heart tone. So we must remember this one. As we palpate on this side, I feel some angular bumps and some nodules that indicates that this is area where the extremities of the fetus is located, or where is the arm or the legs of the fetus is located. And then we will now proceed in the third maneuver, or the Fundic grip. So still facing our clients on the head part, we will now grasp the lower abdomen above the symphysis pubis with our hand near the mother's using our thumb and finger. So on this one, we will press our thumb and the fingers together. So here, so we can determine any movement. If the part is firm and soft, in here. So this maneuver engagement the presenting part of the fetus. So this maneuver intervenes the part of the fetus at the inlet and its mobility. If the presenting part here move upward, if it is move upward, the head of the fetus move upward so that our hand can be pressed together, and if it is moved, and we press it together, and if it is moved, the presenting part is not yet engaged. So it is not firmly settled. That indicates, or if we can evaluate, the fetus has still floating engagement. So on the other hand, if we palpate, there is no longer movable movements, and our hands or the thumb and the fingers doesn't meet, and we can determine that the head of the fetus is settled or firm, it is engaged. Yan. So we can evaluate the fetus is on the 0 point of the ischial spine if it doesn't move. Next one is the fourth maneuver, or the fourth palpation. So So we will place the client's foot part here. We will place. So we will move to the other side. And we will place our first 3 fingertips on the both sides of the uterus above the inguinal groin. So, for example, this is the inguinal groin and this one. So, medyo mahaba lang siya. So, imagine that this one is the end of the inguinal groin, this line. So, we will put our hand above 2 inches above. So, we will place our hand inward but downward movement. So we must take note that the fingers on the right hand must not meet any obstruction as we go to the baby's nape. For evaluation, since the fetal head in this part and in this side is the fetal back on my right, so I must not feel any obstruction, and it must be glide only on the fetal nape because this area is the nape area. So on this side, so we must palpate the brow of the baby, so we must feel obstruction. So as we feel it has an obstruction. On this maneuver, our both hands will palpate different surface. Yan. So this maneuver determines the fetal attitude and degree of the fetal extension if the presentation is cephalic. So since what I have said earlier, our baby is in cephalic position, so you can determine if the baby have a flexed presentation, if the brow is on the same side of the extremities like this one, on this area, para nakaganyan siya. So, if or the head part of the fetus is in line with the extremities, so naka-flex, which is normal, or the complete presentation. On the other hand, we can determine if the fetus is extended or in trunk position, if the brow is on the same side of the back. Nakaganyan si baby, parang nakatingala si baby. So next is we need to auscultate the fetal heart tone. So as we remember, the fetal heart tone is on the right lower quadrant of the mother's abdomen here. In this, we will place the bell of our stethoscope on the area of the fetal back. So we will get our stethoscope. So we will just, and we must warm up it first. So we will count for the whole 1 minute, and we will compare it with on the mother pulse. So here, so this is necessary to observe the rhythm in the pulse. So here, so we will just use the bell of the low frequency sound like the heart sound, and you will observe proper technique of placing fingers on the stethoscope. So we learn in the vital signs. So we will just hear it, auscultate it. So for example, of the patient or the fetal heart rate of the baby is between 110 or 160 beats per minute. So it is normal depending on the sources. And if we get the mother's heartbeat is between 80 to 85 beats per minute, so it is normal. So we will just compare it. So fetal heart rate monitoring is very important because it will be helpful if the patient have a high risk pregnancy. So the patient maybe have diabetes or high blood pressure that also risks the baby in developing or growing. And then it is also important in preventing complication to the fetus throughout the pregnancy. So after that, we will place the patient on comfortable position. On this one, we will just pull down the patient examination down up to the patient's abdomen, and then after that, we will let the patient to change her normal clothes. So next one, we will now proceed for evaluation. For evaluate client comfort and client response on the procedure. For evaluation, we find out that the patient Fundic height is about 29 centimeters. That indicates the patient has 23 weeks of gestation, which is also normal based on the last menstrual period of the patient on last August 27, 2020, and we find out the patient heart rate 84, for example, and which is normal, and the fetal heart rate of the fetus is for example is about 120 or 130 beats per minute, so which is normal. So our findings is all normal. So we will ask the patient, so ma'am, how are you doing? So do you feel any pain upon palpation while we're doing the Leopold's maneuver? So we will ask the client how she feel, if she feel any pain as we press her abdomen, and then we will now document and record the findings correctly and interpret the relations to the mother. So we will write all our findings and we will show it to the mother. So we will say it that the mother has a normal pregnancy. So we don't see any complication. So we can say that don't be worried, mom. So this is all the findings. So you don't need to worry. So just continue your prenatal visit and just eat foods with proper nutrients and take some vitamins as recommended by your doctor or OB/GYN. So on this, we will now end this video. So I don't have any patient to do this since my client is still young and doesn't want to perform as a pregnant woman. So I just do an alternative. So I just use my teddy bear. So I will just show you. So using a pantylet, so high waist panty. So I put a teddy bear. So here, this is the foot. So as I examine, so this is the head part of the teddy bear that plays the fetus. So thank you po.